Hello all, I'm Dr. Jashan-Your and this video is your 101 on the process of egg freezing, which can be divided mainly into 3 steps. Number 1 is the ovarian stimulation, number 2 is the retrieval of eggs, and number 3, of course, the freezing of eggs. Now we start stimulation of the ovaries on the 2nd or 3rd day of the period, and we use hormonal injections which we call the gonadotrophins to do so. Now these injections are very simple to use and have a very fine needle and have to be taken subcutaneously in the lower abdominal area. They even come in pen forms just like the insulin pen, and most patients prefer to inject themselves rather than coming to the clinic every day. Now you have to take these injections for an average of 10 to 12 days until we attain a good size of the follicle, which is about 18 to 20 millimeters. During these stimulation days, you might be called into the clinic 2 to 3 times for your interval ultrasounds, in which we monitor the growth of the follicles and see how your ovaries are actually responding to these drugs. Once we've attained an appropriate size of the follicles, we give an injection for the final maturation of these follicles, which we call the trigger, and ovum pickup is scheduled approximately 36 hours after this. The ovum pickup is the procedure by which we are going to retrieve your eggs, and since this is being done under anesthesia, you're not going to feel any pain in this. With the help of a transvaginal ultrasound, we locate the ovaries and a very fine needle is passed through the vagina into the ovaries, and the follicular fluid is going to be aspirated out. And in this follicular fluid is going to be the egg complex, which is then later separated and frozen at sub-zero temperatures. Once we've frozen these eggs at sub-zero temperatures, which is almost minus 190 degrees Celsius, all the biological functions in these cells, they stop, and your eggs can be stored for your future use. An approximate cost for this procedure in India can be anywhere between 1.5 to 2 lakhs, but it can vary from different hospital to different hospital, and you might have to pay additional cost for freezing your eggs each year. Consider this like an insurance, but for your eggs. Thank you.